Suresh Gandotra inflicted catastrophic injuries on a 22-year-old abortion patient. Investigative documents sat forgotten at the California Medical Board for 3 years. Had they taken action, 23-year-old Magdalena would not have died from similar injuries at Gandotra's hands. This is Christina with the Sisyphean Journal, and today is December 8th. The Medical Board of California knew something about Dr. Suresh Gandotra that 23-year-old Magdalena Rodriguez didn't know, and had they acted on that knowledge, she wouldn't have died. On December 8th of 1994, 23-year-old Magdalena traveled from her home in Tijuana to Gandotra's clinic, El Norte Clínica Médico, in San Isidro, California. Magdalena had an appointment for a safe, legal second trimester abortion. She didn't know about what Gandotra had done to another woman just 3 years earlier. That young woman, who was 22, had also traveled to San Isidro from Tijuana. She had been 18 weeks pregnant. Gandotra made an unsuccessful attempt to get the fetus out, but when he couldn't, he sent the patient home saying he hoped the fetus would drop. She returned the next day, but had already started to develop an infection because Gandotra had torn a hole in her uterus. He continued to try with the abortion, but wound up pulling out part of her bowel. When he realized how seriously injured she was, he sent her to the hospital. She arrived in shock, having lost 40% of her blood. The doctor who performed emergency surgery to save the patient's life said, "The damage was so extensive, it was difficult to identify the anatomy." So surgeons had to perform an emergency hysterectomy to save that young woman's life. Gandotra's comment on the case? "I guess I screwed up." The medical board screwed up as well. The documents regarding that investigation just sat in their offices, forgotten. And Gandotra himself had a similar comment about what happened to Magdalena. "I knew I screwed up." Yeah, that about covers it. Everybody screwed up. So Magdalena's abortion started at 10 o'clock in the morning. Now, Gandotra was struggling to remove all of the fetal parts, and he realized something had gone wrong. And he later told the medical board that he didn't send her to the hospital because he didn't have any admitting privileges. And Magdalena said that she felt okay and she wanted to walk home. To Tijuana? This is a sign that the patient is in shock. She's not getting blood to her brain if she thinks she can walk home to Tijuana from San Isidro, California, right? Well, it wasn't until 3:24 p.m. that Gandotra called the University of California San Diego Hospital and asked for directions to send Magdalena there by car. They said that he needed to call an ambulance. They began to assemble a specialized team to deal with the catastrophic injuries they were expecting. In the meantime, Gandotra left Magdalena unattended and performed other abortions. When he finally called an ambulance, he didn't tell them that there was a hospital already waiting to receive her with an operating room prepped to deal with it. The ambulance arrived at 4:33 p.m. and found Magdalena on the floor in a pool of blood, evidently lifeless. He didn't tell medics about the hospital. He didn't tell about the procedure he performed. He didn't provide a medical history. He didn't provide any information. So the medics just took Magdalena to Strips Chula Vista Hospital, where she arrived at around 5:15 that evening. So when she arrived, she had no vitals and was unresponsive with fixed, dilated pupils. Her abdomen was so distended with blood that when surgeons opened it, blood splattered out into the operating room. Magdalena's uterus was ruptured with a fetal limb protruding through it into her abdomen. Her cervix bladder, and colon were also lacerated. The mangled and partially dismembered fetus was about 30 weeks gestation. And in spite of the surgical team's heroic efforts, Magdalena was pronounced dead from massive blood loss at 10:17 p.m. The autopsy, of course, found that mess and also described the body of her unborn child. The body of the baby was not complete when autopsied. Both arms had been cut off. The heart, lungs, liver, and other organs had been cut out. The front of the chest and abdomen were missing. The right femur was fractured. The head was intact except for an area on the scalp which had been taken off from the back of the head. So Gandotra had horribly mangled the baby and then just pushed part of it through a hole in the back of Magdalena's uterus into her abdominal cavity. Gandotra's attorney said, "We don't believe this was a blow to the standard of care, nor do we believe it was malpractice." In contrast, a nurse at the hospital that tried to save this young woman said, "I've never seen anything like this before, and I don't want to again." After Magdalena's death, investigators went to the clinic and found that Gandotra had no means of providing transfusions, had only first trimester consent forms, even though he did a lot of second trimester abortions. He didn't take after hours calls to deal with patients who were suffering complications after they were discharged. He didn't keep adequate records, and even though he was obviously targeting Spanish-speaking women, he didn't speak Spanish. He couldn't talk to 95% of his patients. And Gandotra performed about 100 abortions per week at that clinic. He had previously served 5 months of a 15-month sentence for committing Medicaid fraud and allowing non-licensed people to perform medical procedures and prescribe drugs at his facility. Now, eventually, a homicide warrant was sworn out on him for what he did to Magdalena, but he fled back to his native India. As far as I know, he's still on the wanted list for Interpol, and they're doing absolutely nothing to protect the women of India from this man.